It's been 6 years now that I gave birth to my daughter, and I have been trying to conceive again. It's not happening. What is wrong with me? Does it mean that I have hormonal disorder? Why am I not conceiving again? I have given birth before. I thought when somebody gives birth, the person will continue to give birth. Hi, my name is Tochi and you are watching Tochi Fertility channel. If you are new here, I welcome you. Like our page, follow our page, share our videos, subscribe if you like. So this is the question people often ask. In this video, I am going to tell you the cause of secondary infertility. Second infertility means that a woman has given birth before and now she wants to conceive again and she's finding it difficult. Now she wants to know what is the cause. What are the causes of secondary infertility? This thing happens in most of the women, but they do not know. You know, sometimes when something is happening to people, they think it's normal. Whenever something is going wrong in your system, don't take it lightly. You are still under the age of reproduction and yet your menstruation is not coming out. You think it's normal. You are not ovulating. You think it's normal. You are not pregnant and you are not breastfeeding. Breast milk is coming out from your breast. You think it's normal. You are having severe pain, severe bleeding. You think it's normal. This is the problem people have when they have issues. They don't always identify it. They don't even accept it. They think it's normal. You have to watch yourself. If you're a woman trying to conceive, even if you don't want to conceive, your health is very, very important. Now, I have defined what secondary infertility is. Secondary infertility is the inability of a woman who has given birth before to conceive again. And now, what causes this? Number one is advanced maternal age. If you can remember, in all my videos, I always tell you people that once a woman clocks the age 35, this is when you start having issue with your hormones. This is when all kinds of ailments remembers your system. So this age, things becomes difficult because your body, even your eggs, they are dropping. So this could be the problem. And if you watch it, people who suffers from this secondary infertility, before they become pregnant the first time, it was difficult for them. Now when they become pregnant, they will forget everything they did. They will forget everything they took. They will forget all the method, all the processes that they passed through before they become pregnant. That is why they find it difficult. Let's take, for example, somebody who have a hormonal disorder like a thyroid. If you have hormonal disorder like thyroid, is going to affect your FSH and thereby affecting your ovulation. Now, maybe we are placed under medication. Now, the medication will balance your hormone and you become pregnant. After giving birth, you might have forgotten the name of the medication. You have even forgotten what you were diagnosed with. So now you want to become pregnant because you stopped taking that hormone drug. Your body scattered again. The hormonal disorder will start again. So by the time you realize that, oh, before I became pregnant, I took something like this. I have reminded a lot of people here who had this secondary infertility. They forgot what they took, and when they came here, I reminded them, they went back, and I believe now they are pregnant. Number two is impaired sperm production or low sperm count. You know, sometimes when a woman is not getting pregnant, her husband often blame her. The problem is coming from you. You have removed all the babies in your womb when you were growing. You did series of this, you did series of that. I don't have a problem, especially those of them that have given birth or that have impregnated a woman before. They think that they are okay. As the age is going, that is the way it affects your sperm. If your husband is up to 40, 50, men's infertility starts at the age of 50. But before then, especially if your husband is the kind of man that smokes, that takes alcohol, let him go and have his sperm checked. A sperm that is not strong, if your husband's sperm count is low, if the motility, that is the movement, is low, it's going to affect you as a woman. You might not necessarily have a problem, but the problem will be coming from your husband. Let's say your husband have low sperm count. This low sperm count cannot fertilize egg. If your husband's sperm motility is low, it cannot fertilize egg because it cannot even walk up to the egg to fertilize the egg. So I advise women who are trying to conceive, as you are going for your own fertility checkup, let your husband go for sperm analysis. His sperm count must be good, sperm motility must be good, sperm morphology must be good for him to impregnate you. This is very, very important. So you might suffer secondary infertility when your husband's sperm is low. Next one is damaged fallopian tubes. Maybe during the process of your first pregnancy, depending on how you deliver, your fallopian tube might be damaged, either through infection or through cessation or through many ways. So for damaged fallopian tubes can cause secondary infertility in women. Another one is endometriosis. What is endometriosis? Endometriosis is a situation whereby the tissues that are supposed to grow inside your uterus grows outside your uterus, causing a lot of problem. The sign of it is heavy bleeding, irregular menstruation, lower abdominal pain, pelvic pain, severe pain when having intercourses, and you will see some clots of blood in your menstruation. I hope somebody is getting me. I am taking my time to explain all these things. So when you have endometriosis, that is why I tell women, if you give birth, please try to detoxify your system. If you do not detoxify your system, if all the bad blood didn't come out, it may cause cysts, it may cause fibroid, it may cause endometriosis. Always try to detoxify your system, whether trying to conceive or not. Is very, very important. Another one is uterine condition. Like people who have a fibroid, it can also cause secondary infertility. Another one is polycystic ovarian syndrome, that is PCOS, where you have small sac filled of follicle inside your uterus. They are not developing, they are not maturing, they will never burst. You will not be ovulated. So you have to work on it. And the best way to cure PCOS is by changing your lifestyle. It's a situation whereby a woman have more of men hormone called androgen. For example, people with PCOS are always fat. They always have hair all over their body like chairs. In the position that men have this hair, they have acne, oily face. So the best way to cure is, sometimes doctor may give you pills, and the reason for giving you those pills is just for the symptoms, like having heavy bleeding, having pains, to stop, but it doesn't cure PCOS. The total cure that you can use to regain and become pregnant is by changing your diet. I hope you get that. Another one is excessive weight gain. When you are too overweight, it will be very difficult for you to become pregnant, especially if you have given birth before all of a sudden you start adding up weight. It's going to affect you for the second time. Another one is lifestyle. If you are smoking, drinking alcohol, it's going to affect you, especially that of man, because alcohol reduces sperm count, it reduces sperm motility. If you are smoking, the nicotine in the cigarette will also affect you. So I have spoken at length. You guys don't watch the video. If it is your first time of coming across my page, you are welcome. This is the home of fertility, where God bless women who put their trust in them. So if you like what you just watched right now, follow this page, like this page, share this video, subscribe to our page to support us, and God in heaven will bless you. I love you all. Bye-bye.